This will begin the demo part of just showing safe touch practices related to how we can navigate the whole massage practice, from intake and client interface to the actual hands-on part of this, to help avoid any kind of misinterpretation, and with the end result being that we are avoiding any kind of, through that misinterpretation, any kind of false claims regarding impropriety. And a lot of that is going to be related to making sure our clients feel as safe and as comfortable, and through using our words, which is a valuable asset, by the way, talking to your client and getting a lot of confirmations and even clarifying in the first session or two that there's going to have to be a little bit more dialogue so that we're making sure they feel safe and that the session is being tailored to their desired outcomes, right? We just need to be better, I feel, at confirming that in those first couple of sessions, we do need to communicate a little bit more. And then after that, everything's good. But by affirming that, we're definitely making a statement as to we are making a priority their safety and comfort, rather than just putting people in a room with, if we're just meeting each other for the first time. All these underlying social awkwardness elements, I think, can be curbed by being a bit more transparent. Now, beyond that though, the actual, tangible elements of what can we do so that a person can feel that they are draped modestly, and everything. Now, of course, first and foremost is that their comfort level, confirming that the bolstering is comfortable, that they're warm enough, that the table heater is warm enough, all that kind of stuff. If you have any choice of music, all that good stuff. So, client, are you feeling, is the bolster comfortable? Are you warm enough? Is there anything I can get you?
Nope, I'm feeling great.
Great. Now, one thing, the way I have the sheet set up right now is what I would tell you to not do. The sheet on any person should not be taut to the point where there's basically any drafts, right? We would like the draping materials, the sheets, the blankets, the towels, to be making contact with their body and as much of all parts of their body, so there's an awareness of coverage, right? So rather than letting a sheet be real taut, we have to get comfortable, and that's where you manage your OCD. You have to get comfortable with things being bunchy and wrinkly. So the sheet should be set in such a way where it can fall and make contact with the table between their legs, where it can fall and make contact with the lateral sides of their body and all of that. Now, a tool that can be used as we move forward. So first part being just get that sheet unstuck, and that's not very hard to do. So my initial contact with people, I tend to come in, I get that bolster set under their ankles, contact, and in the midst of that can be confirming the sheet's not too taut or anything. Contact, and then we're gonna begin to start the session. Confirming from my body mechanics, table height, and all that good stuff. Now, the other part I wanna show is here, is that rolled up blanket or towel that I demonstrated before, which, as you can see, one allows for some cushioning just above the chest. But it creates this additional level of coverage across the entire lateral side of the upper body. And this in particular, for male therapists, I really suggest incorporating more often, at the very least in the first couple of sessions with people, but maybe just forever and always. When we get to other positions, I'm going to be showing how useful this other piece of draping material can be. Something that I have not included, and if you need more information or resources, just look at further videos on our YouTube channel. There's Health Enrichment Center, School of Therapeutic Massage, tons of content there. The draping that we teach in our classroom is a 3-sheet draping protocol where the client's actually laying on top of another flat sheet, which would then allow me to drape and then pull that sheet up and create extra coverage. I'm demonstrating here because I know out there, predominantly in the actual workforce and in many environments, you're going to be restricted to using just a 2-sheet deal. Thus, and you may have also a blanket that you'd be incorporating as well, but that's where you could have the blanket as additional coverage on top of the body, which is very useful, as well as this rolled up towel or blanket. These fleece like materials are a bit more comfy, but you can get towels that certainly have a texture and quality to them that are more nice. But this is just very, very valuable. And then client has already done a thing, but usually they're going to start like this. Now, throughout the session, the biggest thing you have to be aware of is making inadvertent contact with any other part of your body than what you would use to massage. So hands, forearms should ideally be the only part of our body that touches their body, okay? And in the midst of that too, as much as possible, having both hands or some dual contact on so that there is an innate awareness for them where you are the whole time. And it doesn't matter how you do it, but having your non-working hand just resting and making contact, let it help stabilize you and help with your body mechanics, but there's also a comfort element of them knowing where you are, as opposed to what I was just doing of just having one hand and the other one floating, and they don't know where your other arm and hand is. So that's just a simple thing to lock into. It's like trying to always have both hands, both forearms making contact. That other hand can even be help holding the sheet in position, all that good stuff. And as I move around, I just have to be aware of my body. You know, it depends on body shape, type, height, all that stuff. And then your lotion and sanitizing materials. I have these just tucked into my pants pockets. But I then have to be aware of, I have these objects on my upper thighs that potentially could hit and make contact with a person's body. And you may not be as aware because proprioceptively they're not part of your body, right? So you just need to be aware. If you use a holstering thing, or if you have scrubs with the bigger pockets in the front in front of your belly, all of that you need to be aware of, as ideally not making contact with them as much as possible. And if at any time that happens, there's client's elbow, I walk by and bump her with my thigh, then I need to confirm, sorry about that, didn't mean to make contact, you still comfortable and okay? Some kind of way of addressing it, you know, without making it certainly too weird and delicate, but we need to certainly make sure we address. If there's a draping snafu, all that stuff, we need to stop and confirm that they feel safe and okay to continue. And if there's any issue there where you think it's potentially something, and you just got to follow your intuition here. If you think it has the potential to be a problem or skirting into any kind of liability concerns, then you need to make sure you report it. And we'll talk, or I have talked, about just being sure you are good about self-reporting and reporting immediately if anything odd happens, accidental or any kind of bad behavior from either party. Like, you gotta be reporting this stuff and charting it. Okay, so here, drape part, we have that rolled up towel there. Here's where, you know, some tables come with that arm cradle that you can have. I actually prefer to just use the rolly stool, you know, coverage for sanitation purposes. And then while we work, one place where therapists have a lot of problems with body mechanics wise is reaching and applying pressure on the erector spinae group just near the spine, okay? As we do that, if my client's arm and hand are here, and I'm trying to make contact, I'm either going to sacrifice my body mechanics to avoid making contact with their arm and hand, or I could just move their arm and hand. Thus, here, the best body mechanics you're ever going to have is going to be able to be in a position where you're not reaching. So if I just bring the arm over, we have 3 positions we can put the arm in just in prone. Right here, you know, basically an extension. Here, off the side of the table. And then up here on the stool. And arguably, that's good mobility and even screening, orthopedic screening, for the shoulder joint and the scapula anyway. Now that allows me to drape. And here's part of it too, contact. But let me first show, now I can come in and work, be right up against the table and know that I'm not gonna make inadvertent contact with their arm and hand. And right there ends up being one of probably between this extra piece of draping material and reposition the arm, I think that frankly covers a lot of your bases. So we're done. I joke. The other part is when we drape, okay? The matter of how you do it, and I know lots of methods are shown, like tucking into the underwear, tucking into and under their body. If I'm talking about making sure that you don't make inadvertent contact that can be misinterpreted, all those tucks would be happening in pretty potentially delicate body areas. So when I teach this, I do not teach those tuck methods. If you do and you can just be really clear and transparent about it, great, go for it. I prefer to create this roll and bunch. And as I do it, there's 2 things that occur. One, I'm gathering the sheet so I have a handle so I can manipulate this without touching their body at the same time. Also, I can bunch it in such a way where I'm confirming and pulling it to the lateral and or medial sides of the body so that there's a sense of contact and the body being hugged by the draping material so that they know they're covered. So I can manipulate the sheet and get it curled in whatever shape I want without having to touch underwear or anywhere with my hands, because open palm and fingertips are going to be the #1 thing to try to avoid in any of these potentially delicate body areas. It's going to be around the hips, pelvis, around the chest, and scapulas and shoulders is where there's the potential, and medial thigh. All those body areas are ones where open palm and fingertip contact has a different level interpretation than either a fist, but most especially just using your forearm. And before we got our client on the table, we had screened for confirmation that we were good to work around the hips, we were good to work around the chest, the abdomen, all these areas, and then I would clarify with those areas that, one, the draping is kept really modest, as well as predominantly I use my forearms. And even while we work and I do this demo, I'm going to further clarify that as I'm working to areas around the hips, all of that. I'm going to say, okay, we're going to do a little work here at the hips. I'm going to use my forearm, all of that. So that's the big kind of verbal blah, but you can see just this process, having that there, this extra tube for the lateral chest and everything, reposition the arm, and then using the sheet by bunching it up and positioning that way really helps keep everything modest. All right, now as I work, then I'll just kind of go through some quick demo processes here of showing you how I would just go through a session. And one novel element of this might be the use of forearms. And if you're uncomfortable with the use of the forearms and all that stuff, well, that's why I'm here, and there's a ton of video resources available to show more of this for you. One of the easiest ways to avoid this misinterpretation of contact is to use the forearm. It has an entirely different quality of context. And if we can just one, save our hands and fingers for when we actually need them. That's just good for your body and your longevity anyway, but also in terms of just this making sure we're making everybody feel safe and avoiding misperception. Here's the forearm more. What a life hack. So, we're here. Certainly pumps for kneading. I tend to use hands and lighter pressure to just do more superficial work, warm the area up. But as you can see, what this avoids is if I'm working, there's no concern as to the client having a sense of exposure because there's this additional piece of draping material on the side. And then we just go about our work. So here, next part, you know, I might just speed this, ideally the video, I'll speed it up for you or something, but we'll show how I'll just go through a session. There's use of the forearm for the lumbar area, working my way up. You'll see better when I am on the other side of the body. Other ways of making contact, let's say I'm trying to pull the tissue of the lumbar area, lumbar spine up and away from the sacrum. What is happening here, you might not be able to see it here, but on the other side you will. This hand is holding the lateral side of the opposite leg. So I'll show as I work my way up. Once I get here, I reposition the arm. And then it allows me to hold the arm while working in this, you know, mid lower trap rhomboid, just anything between the scapula and spine. And I'm stabilizing the arm the whole way. And of course I'd be doing more strokes, but just to speed this process up, showing how I would work. Arm now, here's an area where there can be stuff, but again, a forearm works really nicely, and I don't have to worry about, you know, ticklish armpits and all that stuff. And repositioning the arm again. Forearms. Now I'll show a similar stance and application for the medial thigh and sideline. But being able to stand on the side here, and here's the forearm like this. This avoids this hand coming over and making inadvertent contact. And it, like, light touch and touch that doesn't seem related to the area you're massaging is something we need to be careful of. So if I'm choosing to apply pressure this way and my fingers are grazing across the skin in a light ticklish manner, that might have a weird context to it. If my hand were to come down and be on the hip and all that kind of stuff. So this is one area where I flip my stance, since it's on the outside of the table anyway, it doesn't hurt my body mechanics, to just apply pressure this way. I cradle the elbow so I can control what the arm and the hand is, and then there you go. I remember unusually enough, when working with the athletes, they talked about one of the things, I was able to kind of get some transparent answers, because there were some, you know, very alpha personalities that were uncomfortable with the idea of massage and kind of had the impression of it being something that was a bit more intimate, right? And one of them was, and I really appreciated his candidness, was talking about how a hand massage felt particularly intimate. I don't think those were the words that were used, but that it had a quality to it that maybe is something that we don't think about being able to be misinterpreted, but very light, delicate work at the hands and light touch the hands and feet too. But it was an interesting aha moment for me to recognize how that could be something that would be misinterpreted. Thus here, you know, if I'm trying to make sure to avoid that, and also just to be efficient, I'm mostly framing all this up. I don't work a lot over being worried about this. I do a lot of stuff using the draping materials and positions so I don't worry about it. But my massage, and as a male, what I say to you is you're going to tend to do better to structure your demeanor, your room if you're decorating, everything in a more clinical kind of way. Thus here in the hand, rather than it being a lot of soft touch with my fingers and hands as well, if I just change and use a soft fist that has a different kind of quality of touch and context to it. So there I'm just using, works really good. I stand, going into the thenar group, working my way right through. I line myself up with now the second metatarsal, third, fourth, and fifth, and I'm good to go. I get the supine, I'll do some stuff with the fingers, but it's efficient as well as, although it's not always something, I'm trying to bring attention to anything and everything I could potentially consider a factor here. All right. Ideally, I'm showing some good body mechanics, ideas of how we can conduct and work ourselves as well. So here, just to be able to show, since you can see it better, how I would work in this lumbar area. Motion distribution, and then coming in and using that forearm. Noting not what this arm is doing, but what's this arm doing. Rather than just hanging out and trying to avoid contact, let it rest. And they're paying for a massage, right? Touch is a big part of massage, right? So let this arm rest somewhere that's comfortable for you. What this allows for me, squares my shoulders up, allows me to use my body weight more efficiently. But then I can, if there's neck and shoulder issues, I can just hold contact there. You know, let your intuition, as you and your students start building out, working more efficiently on how we can be doing a couple things at once. It's a case where I have the lumbar spine and the cervical spine, a lot of neurologic correlations there, right? So just contact in an area that could potentially be involved is just another nice efficient option. Now I worked up here and maybe I forgot the arm is here off the side of the table. I just making sure I'm constantly aware. You don't get to have a lazy, daft day when it comes to draping and making sure a client feels safe. So I notice that, I reposition right then and there, and we're good to go. I think we have a sense that moving the client, even passively, is somehow disruptive to the relaxation aspect, and it's not. If you just integrate it in a nice smooth way that feels like it flows and is part of your session. You know, I have plenty of long rants, I'll be honest, about the benefits of just including passive joint movement as much as possible in sessions. If we want to be facilitating additional benefits beyond just the connective tissue and muscle structure, passive joint movement is good for the joint capsules. It also facilitates venous blood return and lymphatic fluid movement. So if we can incorporate more joint movement, it's going to allow you to position the client so that you're safe, they feel more comfortable, and you can even then explain how it's beneficial related to therapeutic outcomes, rather than it just being in the context of, making sure they feel safe and we're not accidentally bumping into their arm, right? All right, come back up, I reposition the arm, I come in, work all through here. As said, there would be more applications. I'm just kind of trying to show how you would navigate through the whole body in this. So here you won't be able to see as well. Working my way through. Soft fist for the palms. and then we reposition, and we're good to go. Throughout any of that process, I just really want you to be able to see this. Throughout all that process, once I got to the arm, I really should be thinking about trying to re-drape these areas. I want you to be able to see, but as opposed to, and once I get done working on the torso, and I'm to this part, that's a good spot as I'm making contact with the arm to grab that sheet, make sure they're covered. We can always bring this into the context of we're making sure they're warm and cozy, and then that would be the part where I'm then working on the arm. And then all I would have to do then is reposition the arm here, underneath, or they could be off to the side of the table where they'd be more comfortable. That's actually where I tend to be more comfortable. I find a lot of my people are more comfortable is the arm just off the side like that. Okay, now coming to a really important part. How do we work around the hips? How do we even verbally address and talk about this? You know, everybody gets so scared and weird about working here. And it's too bad. It's too bad that we have to worry so much about this, but the world is what it is and we have to get over it. And we have to find ways to address and work here, explain the benefit and the purpose of this, but also being aware of the nature of how these are body sensitive areas. They're charged, right? There's a whole context and nature of this. There can be body insecurity, there can just be the nature of like sexualized zones and all that stuff. And so we have to do a good job, especially in our first couple of times with clients and teaching our students that guess what, they're going to get out there and everybody's going to be first time clients. So I frame everything in entry level that I'm getting them ready for first time clients that have never had a massage before in their life. So there was all the verbal screening and the intake process where we clarified this. But furthermore, what I then am going to be sure to do is rather than just not saying anything and moving to the next part, then I clarify, okay, now we're gonna be working on the hips. So I'm just gonna drape your leg here, bending the knee, and I'm gonna be moving your hip back and forth while working around the hip, and that's gonna help with stuff related to that. I would have framed that better, so let me phrase that. Now we're gonna undrape the lower leg, bend the knee, and as I work, I'm gonna be moving the hip back and forth while we work, and that'll be far more beneficial. So is this comfortable for you right here?
Mm-hmm.
Great. And now I'm already getting assessment stuff. There's a lot of layers to this where I'm confirming, how is her hip doing? And it's limited. It's limited in internal rotation. While working here on the hips, and you'll see a little bit better when I'm on that side, incorporating this passive joint movement while applying compression applications here. It's going to be gluteus maximus, the posterior elements of gluteus medius, as well as the entire deep lateral hip rotator group, okay? Really important structures. And even here, hey, all that piriformis syndrome stuff with sciatica, right? It's essential that we get good and efficient at working here. So I explain through that. All right, now I'm gonna apply a forearm here right by the hip. And it's important that you tell me the pressure is just right. I'm gonna apply a little pressure. You tell me the pressure is just perfect.
No.
Right there, perfect. And then we're gonna move the hip. And then that's all it has to be. Now in a relaxation session, I'm gonna mostly frame this related to a relaxation session. If somebody has pain and mobility related outcomes, I think the tendency for misinterpretation is far less. So all we have to do is keep this joint movement very rhythmic, but the sensation, the interpretation of the touch changes very much, because now with every motion I do, I am clarifying that the application of where my forearm is, applying compression on gluteus maximus and gluteus medius, just say, you know, muscles related to the hip, that with this movement, it's very clear that it's about the hip. And rather than having to glide or anything like that, which I wouldn't over the sheet anyway, for male therapists in particular, but a lot of therapists are being pretty much charged with not moving underwear and draping the glutes and stuff like that anyway, that getting good at working over the sheet is essential. And so that's all it takes is a forearm plus this passive joint movement. The whole time they're feeling how those muscles are shortening and lengthening. When we're getting substantially more benefit in this essential area for people. But in terms of avoiding misinterpretation, if we include this, it just makes it so clear that it's about a physical mobility related aspect of the session, rather than just making a static applications to the glutes. That's where it can be easily misinterpreted, and what tends to happen for therapists is they're too scared of working in the area, so they avoid it entirely. And that's gonna not be good for their longevity, even with client maintaining your clients and recruiting more, client retention. But it's not gonna be beneficial even in client retention, because the benefits of working here related to low back dysfunction and other issues down the kinetic chain or up, whatever, is so essential. All right, so I'm going to show that over on the other side. All it is great. This is where, if I have to, let's say the client's very tall, something like that, I may have to pull a lot of that draping material to make sure there's a lot of material between the legs. That way, as I do any of this movement, there is no sense of a draft, no sense of being undraped in a way that would feel unsafe. And if we have to, usually, as I said, you would have that extra, we teach the 3-sheet draping protocol where you would have another piece of drapery. I've used even just the fitted sheet to be able to cover their foot like that. But that sheet right here, that's the benefit of just this bunch technique of making sure there's a lot of sheet gathered, a lot of draping material gathered between the legs. And there's other things out there. There's those drape vines and weighted blankets and all kinds of stuff that you could use to, hold the sheet down in some areas. But then I go, all right, we're gonna apply a forearm here. There is for gluteus maximus. All I'd be saying to them, or teaching my students, is, you let me know when the pressure is just right. Okay. And then this is little passive, very rhythmic drape movement component back and forth. So a few points there. I usually have one that my arm will be a little bit more horizontal, a bit more in line, parallel with the femur. Then if I turn my arm, or my forearm is more vertical or perpendicular with the femur, that'll bring my forearm application more to the lateral side of the body, to gluteus medius. And then we come more inferior, right? Just posterior and lateral, medial, sorry. Just posterior and medial to the greater trochanter. Then I'm on all those deep lateral hip rotators. And if I'm picking, if there's an additional nuance here, if I'm picking the, most people need more, this client is a great example of it, would need more internal rotation. That means the external rotators are too short, thus that's a very essential place to work for hip and or low back dysfunction. And as we know, all this stuff will travel up and down the body, but this forearm application plus the joint movement, that is the big life hack in this position. All right. Now, working on the upper leg in prone, working on the legs in prone in general, frankly, is pretty inefficient. And I have to be as patient as I can be. But I know that for the most part, the massage therapy community works the majority of their sessions in prone and supine, and especially way too much in prone. If I could change anything, I would change a lot. But in this context, I would really try to suggest that in general, and I will have certainly explained this further and again in a lot of other videos, the benefits of using sideline position are enormous, including the sense of safety and misinterpretation of the touch, okay? Now, I have been in sessions, and guess what? We're in the United States. We are a more modest society related to this. I've been in other nations where there isn't that sense of interpretation, and there's a lot of hand contact into the medial thigh, doing knee applications all the way up. And guess what? Making contact with areas that I certainly would not like to have my clients experience, but the misinterpretation doesn't seem to be as inclined there, okay? So we have to just be aware of some realities regarding in what society, what culture we're working. So here, my personal philosophy is, and even just from a body mechanics perspective, is it is difficult to try to work on this more medial aspect of the legs, the medial aspect of the hamstrings, the calves, gastroc, all that, and especially the adductors. It is very difficult, body mechanics wise, to do it in prone. And the only way you're going to do it too is probably with making what could be perceived as contact with this whole medial thigh area, and a lot of times with your hands. And that's what I'd say is a big place of no-no, to have your open palm contact going up that medial thigh. That's a real easy place for people to misinterpret what's going on, right? So if we can use our forearms more, awesome. But it's going to be difficult to achieve that in these positions. I can maybe do it reaching across. I've done this, but then guess what? I'm making contact with their leg with my body. I can try to do this, but all of that is potentially just awkward for a variety of reasons. The short answer to this is, in prone, we can get the lateral aspect of the posterior leg very well. And I teach and strongly suggest we teach more getting the rest of that whole medial, posterior, and outright medial aspect of the leg in sideline. When we get there, I'll show how you can do it so much more efficiently while avoiding all these contact issues. But here, if I use that forearm, don't let this hand be up here. My hand is going to be set in such a way where it's completely not going to make contact, and this forearm element of the application, this all smoothly transitions because I was here for the deep lateral hip rotators. All I have to then do is drape a little bit of this lateral part of the leg, no sense of exposure or anything going on with the upper medial thigh, and then I'm here. And here's a little bit of that example of just including a bit of that passive joint movement. I think from an interpretation of touch, including joint movement, one is substantially more beneficial. I can create a whole word salad of how beneficial just including that passive joint movement is. But I think it consistently will create an interpretation for a person if the applications you are making are related to the anatomy and the function that we're seeking to help them with. So here, all the lateral, I'm mostly focusing on the left side. Obviously the lower leg, we don't have to be as cautious and worried about all this. But my angles are good to work on more on that lateral side of the body. Let me show some of that here. I come over. And that's all what it looks like. Where my head is actually usually just going is thinking more specifically about the anatomy. I'm thinking about IT band and bicep femoris. and I could articulate that. And there's just a quality to the session, again, that we include a little bit of that joint movement. It just makes it seem that it's about the hip, it's about the knee, it's about the shoulder, right? And particularly for male therapists, you gotta do better to structure your stuff a bit more in a clinical kind of framework. You know, there are biases everywhere. None of it is fair, and oh well, right? And it's the same principle of there being a bias for male therapists being requested, because we're seen as stronger. And that's not fair to any female therapist either, is it? So in the spa atmosphere, relaxation-based outcomes, we do sometimes have a harder time building up our client retention, having clients initially be comfortable with us. It is what it is. But sometimes we sometimes also end up having a leg up in the athletic medical world for reasons that aren't realistic or valid either. And for what it is, some of it we have to accept and maybe even lean into. And for entry-level male therapists getting out there in the field, I just say you're better off structuring your demeanor in your sessions a little bit more in that clinical, therapeutic related dynamic, and that in itself can be very helpful. All right, now that's prone, and next we'll be going on to sideline.